So glaucoma research ongoing trials. Treatment versus treatment trials. Coming to the light, what is light? It is laser in glaucoma and ocular hypertensive study which was conducted in 2019. What was the objective of the study? It was to compare the eye drops versus selected laser trabeculoplasty as the first line of therapy for ocular hypertension and primary open angle glaucoma. The design, the first line of eye drops were prostaglandin analogs, second line were beta blockers, the third and fourth line were tropical carbonic anhydrase inhibitors and alpha agonists. Coming to the primary outcome, they measured the quality of the light. The secondary outcomes were the visual acuity, the IOP, the cost, disease progression, and need for glaucoma surgery. The patient demographics and the ocular characteristics were similar between the two groups. If you can see in the results, the SLT group did much better compared to the eye drop group. The limitations of the study were it utilized a target-to-target design that does not provide clear IOP reduction parameters. So coming to the clinical pearls, the SLT is both clinically effective and cost-effective option for the first line of treatment for primary open angle and ocular hypertensive patients. It may spare patients eye drops and reduce the risk for future glaucoma surgery. Next coming up is the Ahmed versus the Bowel study, which was conducted from 2011. Here they compared the outcomes of patients undergoing the placement of the Ahmed versus the Bowel glaucoma drainage implants. Here the patients were randomized to receive either an Ahmed glaucoma valve drainage implant or a non-valve glaucoma drainage implant. The primary outcome as a surgical success was measured by 5 parameters that included the intraocular pressure, the medications, the adverse events, interventions, and visual acuity. Complete success in this study was defined as an IOP of 5 to 18 millimeter of mercury with a 20% reduction of IOP of all ocular hypertensive drops, and the failure was defined as any of the following: IOP less than 5 millimeter of mercury or greater than 18 millimeter of mercury. Coming to the results, we can see that the Bowel group did better, but vision-threatening complications were more seen in the Bowel group than in the Ahmed group. The limitations, the intraocular pressure was primary parameter determining success and was standardized at 5 to 80 millimeter of mercury, which does not take into account the individual patient goals. The predefined success parameters resulted in a few patients meeting criteria for the success. Furthermore, clinical progression of patients was not taken into account. The clinical pearls, although the results in the Bowel group was better, but there was significant vision-threatening complications in the Bowel group than compared to the Ahmed group. Coming to the TVT study, that is the tube versus trabeculectomy, which was started in 2005. Here the objective was to compare the safety and efficacy of trabeculectomy to tube shunt surgery in patients with previous intraocular surgery. Here they designed the patients and they were randomized. One group underwent the tube while the other group underwent the trabeculectomy. Coming to the results, after 3 months, both procedures produced sustained pressure reduction to the low teens throughout the 5-year duration of the study. The trabeculectomy had a higher long-term failure rate compared to the tube, whereas the trabeculectomy eyes with mitomycin C achieved better in early IOP control in the first 3 months and less use of adjunctive medical therapy in the first 2 years only. Limitations, patients with refractory type of glaucoma like neovascular glaucoma excluded. Mitomycin C was used for 4 minutes, which is much longer than most surgeons currently used, and this could be accounted for the high rate of hypotony in the trabeculectomy group. Coming to the treatment versus no treatment trials, the ocular hypertensive study, which was conducted in 2002, had 2 major goals. The first one was to determine if early treatment of people who have increased intraocular pressure with topical ocular hypertension would prevent them from developing primary open angle glaucoma, whereas the second goal of this study was to determine which people are more likely to develop glaucoma. Design not going into the further details, the diagnosis of glaucoma was made when patient developed a reproducible visual field defect or reproducible deterioration in the appearance of the optic disc. The results, the predictive factors found included increasing age, increasing intraocular pressure, decreased thickness of the cornea, and increased cup disc ratio. The ocular hypertensive patients are at a low risk of developing glaucoma, as low as 1 or 2% over 5 years, where the other groups are at a much higher risk at the rate of 25 to 35% over the 5 years. The main outcome measures, the primary outcome was development of the reproducible visual field abnormality or reproducible optic disc deterioration attributed to the primary open angle glaucoma. Coming to the limitations, the study goal was study IUP goal was 20% reduction. There was no measure of the medication adherence, not population-based epidemiological study. Some risk factors underrepresented. There was high threshold for diagnosis primary open-angle glaucoma, and the criteria for conversion of primary open-angle glaucoma adjusted during this study. So they concluded that the topical ocular hypotensive medication was effective in delaying or preventing the onset of primary open-angle glaucoma in individuals with limited IOP. The OHTS supports offering eye drop treatment to ocular hypertensive people and was studied carefully to see if the medications were safe or not. Next, coming to the European Glaucoma Preventing Study, which was in 2002. Here, the objective was to evaluate the efficacy of reduction of IOP by dorzolamide in preventing or delaying POAG in patients affected by ocular hypertension. The patients fulfilled a series of inclusion criteria including eye intraocular pressure, 2 normal and reliable visual fields, and the normal optic disc. The main outcome measure here was the efficacy endpoints were visual field and optic disc changes or both. And in the results, we saw that during the course of the study, the mean reduction of IOP in the dorzolamide group was 15% after 6 months and 22% after 5 years. Limitations of this study was there was a high dropout rate. Only one type of IOP lowering medication was evaluated. Then the intraocular pressure difference reached between the two groups was small. The pearls for clinical practice, the same predictors for development of POAG in OHTS study and were the baseline older age, the higher intraocular pressure, the thinner central corneal thickness, vertical cup disc ratio, and higher Humphrey visual field pattern standard deviation. The EJPS study failed to detect the statistical difference between the chosen medical therapy and placebo, either in IOP lowering effects or in the rate of progression of POAG. Thank you for your patient hearing. With this, we end